1. Introduction. RAWSEP View. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only. For home building and furniture building, for just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree, but it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lungs, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RAWSEP View purple air PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary. Episode 57 DEA February 14, 2025. Louisiana Health Department will stop promoting mass vaccination. RAWSEP View indoor residential wood burning emits airborne PM 2.5 particulates that enter the yards of near neighbors and sicken the near neighbors. This health hazard is preventable if wood burning is stopped, and clean energy home heating such as heat pumps that work down to 40 degrees below zero and lower monthly electricity bills immediately. Heat pump rebates of up to $8,000 based on a sliding income scale are also available in 2025 in some United States. Other airborne illnesses affecting Americans in 2025 are the bird flu, COVID-19, and the flu. There are vaccines available in 2025 against COVID-19 and the flu as of December 20th, 2024. The Centers for Disease Control announced that at this time, there is no recommendation for people to be vaccinated against bird flu, and there is no commercially available vaccine against avian influenza viruses, including H5 virus. In episode 57 DEA 1 United States bird flu, COVID, and flu 2, the Louisiana Health Department says it will stop promoting mass vaccination. 3 Texas measles outbreak. 4 Europe. 5 in Germany. The Friedrich Merz flirtation with neo-Nazis makes a minimal dent in his popularity. 6 A liberal explains his point of view. Main content. 1A United States Trump cuts to medical research temporarily halted nationwide. Court pause on Trump cuts to medical research funds is expanded nationwide. The federal order temporarily halts the Trump plans to slash $4 billion in overhead costs for research at universities and medical centers into diseases like cancer. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents. Against wood smoke emission particulates, a 501c3 nonprofit organization, the New York Times, February 11, 2025. A federal judge ordered the Trump administration to hold off on a plan that would cut $4 billion in federal funding for research at U.S. universities, cancer centers, and hospitals. The funds, dispersed by the National Institutes of Health, cover the administrative and overhead costs for a vast swath of biomedical research, some of which is directed at tackling diseases like cardiovascular conditions, cancer, and diabetes. The order was issued by a judge for the U.S. District Court in Boston late Monday night in response to a lawsuit filed by university associations and major research centers that had argued that the flagrantly unlawful action by U.S. health officials will devastate medical research at American universities. The temporary restraining order by Judge Kelly, a Biden appointee, expanded on a similar order that was granted earlier Monday after nearly 24 attorneys general sued to stop the cuts in their states. The Trump plan to cap agreed upon payments that universities and health systems receive to support research rocked the academic medical world when it was abruptly announced Friday. Academic researchers and university officials predicted that the plan would shut down valuable studies, cost thousands of jobs, and kneecap the United States in competitive efforts to achieve medical breakthroughs. The plan applied to $9 billion of the $35 billion in grants issued to research institutions. That quarter of the total research funding supports indirect costs that apply to expenses for administrative overhead, including, for example, staff and building or lab operations and maintenance. The Trump administration said it wanted to cut such funds roughly in half by about $4 billion. Opposition to overhead funds emerged in the Project 2025 blueprint for conservative policies, suggesting that the NIH research funding gave too much support to leftist universities. Colleges of pharmacy claimed that the sudden funding cut would wreak havoc on critical research and ultimately force universities to lay off staff, close laboratories, and shutter certain research programs altogether. In a legal memo related to the lawsuit, universities argued that the funds were indispensable in research, including at facilities where lab animals undergo clinical testing for the computer systems that analyze large amounts of data for blood banks and other expenses that cannot be directly tied to a single project. If the funding cutbacks were to survive, legal challenges, the plaintiffs wrote. Research laboratories would literally go dark for lack of electricity. Smaller institutions, they argued, might not be able to sustain any research and could close entirely. A hearing date was set for February 21st, 2025. 1B United States federal worker resignations pushed by Trump amount to only 3% of the federal workforce, not 5 to 10% as Musk estimated. For comparison, 7% of the federal workforce ordinarily leave the government every year. How many federal worker Trump pushed resignations would be a lot? 65,000 have submitted resignations as part of the Musk fork in the road offer, but 150,000 voluntarily leave every year. Anyway, excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization. The New York Times, February 7, 2025. All federal workers, 23 mill workers who quit or retire each year. 146,500 workers reported to take resignation offer. 65,000 all federal workers, 23 mill workers who quit or retire each year. 146,500 workers reported to take resignation offer. 65,000 source FedScope. When the Federal Office of Personnel Management first proposed a deferred resignation package to induce federal workers to quit last week, Musk estimated the offer could lure 5 to 10% of the workforce of the government to leave. That estimate so far looks like an overshoot. By midday Friday, with the original Thursday deadline to accept the offer now paused by a federal judge, more than 65,000 workers had planned to resign, which represents less than 3% of all 23 million federal workers, excluding the military and postal service. The IRS this week also told some employees trying to resign now that they could not take leave under the deferred resignation until after May 15th, an apparent acknowledgement that mass departures now could disrupt tax filing season for millions of Americans. 1C United States vaccines, Senate confirms Kennedy, a prominent vaccine skeptic, as health secretary. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization. The New York Times, February 13, 2025. He was confirmed by a Republican Senate without a single Democratic vote in a chamber where his father Robert F. Kennedy and his uncles John F. Kennedy and Edward M. Kennedy all held office as Democrats during the ceremony. Kennedy said Trump been a blessing in his life. On August 23rd of last year, God sent me, President Trump. The Senate vote to confirm Kennedy 52-48 was almost entirely along party lines. Senator Mitch McConnell of Kentucky, a polio survivor and the former GOP leader, voted no. The lone Republican to oppose Kennedy. McConnell issued a searing statement stating a record of trafficking in dangerous conspiracy theories and eroding trust in public health institutions does not entitle Kennedy to lead these important efforts. Kennedy will now lead the Federal Department of Health and Human Services, a sprawling agency with 13 operating divisions, including some of the Food and Drug Administration, the National Institutes of Health (NIH), and the Centers for Disease Control and Prevention (CDC) that he has called corrupt. The NIH, targeted for budget cuts, has just lost its number 2 official who retired. The CDC weekly scientific journal, which produces reports on outbreaks and other health threats, was muted by orders that prohibited the release of any public communication until it had been reviewed by a presidential appointee or designee. Delaying a report on bird flu information was later posted, then deleted from the department website. What the allies of Kennedy call the vaccine safety movement, its critics call the anti-vaccine movement, which is concerned about safety data link, a government site that monitors vaccine safety after the shots come to market. Mainstream Democrats denounce Kennedy as a conspiracy theorist and science denier and warned that his decades-long effort to sow mistrust in vaccinations will endanger the health of all Americans. A vote to confirm. But he opposes vaccine mandates even for school children, and when pushed he refused to accept the mainstream scientific consensus that vaccines do not cause autism. Senator Angus King, an independent from Maine, said if this were a secret ballot this man would not get 20 votes. 1D United States bird flu CDC study finds silent bird flu infections in dairy veterinarians. The vets had no symptoms, and one worked only in states where no dairy infections had been reported. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization. The New York Times, February 13, 2025. 3 dairy veterinarians, including one who worked only in states with no known bird flu outbreaks in cows, had recent undetected bird flu infections, according to a new study from the Centers for Disease Control and Prevention. The results are based on antibody testing of 150 veterinarians working in 46 U.S. states. The findings suggest that the virus known as H5N1 could be infecting cows and people in more states than have been officially reported since the bird flu outbreak in dairy cows was first reported last March. The virus has been confirmed in more than 950 herds in 16 states. It has also been detected in 68 people, 41 of whom had contact with sick cows. Most people have had mild symptoms. A new study, which was published in the CDC flagship Morbidity and Mortality Weekly report, was initially slated for publication several weeks ago, but was delayed by the Trump pause on public communications from health and science agencies. It is important for public health preparedness that we have this data, said Dr. Nahid Bedelia, the director of the Boston University Center on Emerging Infectious Diseases. The study was conducted at a veterinary conference last September. Participating vets practiced in 46 different states, as well as in Canada. Of the 150 veterinarians enrolled in the study, 25 of them reported having worked with cows who were either known to have or suspected of having bird flu. 3 of the vets tested positive for antibodies to the virus. None of those 3 vets had reported working with cows believed to have bird flu. One had worked with infected poultry. None recalled any flu-like symptoms. One of the vets worked with cows only in Georgia and South Carolina, states that had not reported any affected herds. None of the 3 vets who tested positive for antibodies reported wearing masks or goggles. Precisely how veterinarians are being infected remains unclear, and vets may have less contact with virus-laden milk than the farm workers who spend their days in milking parlors. The vets that we have talked to on these farms are involved in all aspects of care for these animals. The findings highlighted the need for far more testing, experts said, including testing of asymptomatic dairy workers and bovine vets, as well as expanded testing of the U.S. milk supply. The U.S. Department of Agriculture announced a national program to test bulk samples of milk in December 2025. As of February 7, 2025, 40 states were enrolled and actively conducting testing. In Nevada, the bulk testing of milk recently revealed that dairy herds had been infected with a new version of the virus distinct from the one that had been spreading in dairy cows over the past year. The states that have not onboard bulk milk testing should do that, just not assume that because they have not had infected herds reported that they have a little bit of leeway. When the study was conducted last fall, the virus had been detected in dairy herds in 14 states, as well as in 14 people, 4 of whom had contact with dairy cows. One United States COVID-19. What to know about COVID right now? Experts expect cases to rise again this winter. Here is the latest on symptoms, treatments, and testing. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization, January 15, 2025. When it comes to COVID, but one thing has held true over the years: cases climb in the winter. Wastewater data from the Centers for Disease Control and Prevention currently shows high levels of the virus circulating nationwide. Deaths and hospitalizations from the virus have ticked up in recent weeks, and a new variant XEC now makes up nearly half of COVID cases in the country. COVID symptoms have largely stayed the same over the last few years: cough, congestion, fever, a sore throat, nausea, vomiting, diarrhea, shortness of breath, head and body aches. We asked experts why COVID causes diarrhea, constipation, pain, and bloating, and what to do about these conditions. One recent study found that a COVID infection doubled the risk of a major cardiovascular event for up to 3 years afterward. Paxlovid and long COVID. A new report suggested the drug might improve symptoms for some patients, but results were mixed. CDC vaccine recommendations. The agency expanded its COVID vaccine recommendations, urging some people to get additional doses of the updated shots. Lab PCR tests remain the gold standard of COVID diagnostics. They are available in offices of doctors, hospitals, emergency rooms, and urgent care centers, but at home rapid tests are more widely accessible. There are also new ones that can detect both COVID and the flu. You can still order 4 free COVID tests per household from the federal government. The Food and Drug Administration has said it expects at-home COVID tests to detect the virus at least 80% of the time when someone is infected. If you wake up with COVID symptoms and have rapid tests on hand, you should take one. If that test is negative, take a second test 48 hours later. That second test is critical. Past vaccinations and infections make your body more adept at recognizing and responding to the virus. That means your immune system might trigger symptoms before enough virus has built up to turn a test positive. If you are symptomatic and take 2 tests and you are negative for COVID, I think you can be pretty confident that what you have is not COVID. If you have been exposed to COVID but do not have symptoms, the FDA recommends waiting at least 5 full days after that exposure before testing. Some tests may list a past due expiration date, but the FDA extended the expiration dates for many tests, which you can check here. If a test truly expired a few weeks ago and it has been sitting in a room temperature environment like a closet, it is most likely still okay to use, but keep an eye on where you store your test in cold weather. If a test is delivered to your doorstep and left outside in freezing temperatures, bring the test inside and let it come up to room temperature before using it. How long are you contagious? If you do test positive on a rapid test, that is a signal that you could spread COVID to someone else. You can typically expect to be contagious for at least 5 days. However, if you test negative a few days into a bout of the virus, you are most likely no longer contagious. People who are at high risk of severe disease from COVID, including people who are over 65 or immunocompromised, can receive treatments for COVID that are thought to be effective if they are initiated within about a week of developing symptoms. The Department of Health and Human Services has a directory of places to obtain COVID treatments near you. Doctors typically reach for Paxlovid, an antiviral pill that can slow down the rate at which the virus replicates inside the body. Not everyone can take Paxlovid, though the drug can interact with some antipsychotic drugs, medications that treat irregular heart rhythms, some migraine medications, and other drugs. There are other less commonly used options for treating COVID, including remdesivir, an antiviral given through infusions at a healthcare facility. Doctors may also prescribe the antiviral pill molnupiravir to some adult patients. The FDA has also authorized a drug to protect high-risk people before they get infected, a monoclonal antibody infusion called Pemgarda, and vaccines slash the risk of becoming seriously ill. The FDA approved updated vaccines in August. Those vaccines target variants of the virus that are very similar to XCC, the dominant variant. Spreading now in the United States, immunity wanes a few months after you get a shot, but you will still most likely have protection against severe disease if you got the latest vaccines that became available this fall. And if you have not, it is not too late. Some people clearly still die from COVID. Some people still get long COVID. Even if they had it before and dodged the bullet, it is not inconsequential. 1F United States flu cases are surging. At least 24 million cases have been reported so far this season, and the virus is still spreading widely. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization, February 12, 2025. This flu season has been particularly brutal, and it is not showing signs of letting up. Since October, there have been at least 24 million cases in the United States. The Centers for Disease Control and Prevention has estimated that there have been as many as 650,000 hospitalizations, which would make it the highest hospitalization level since 2017. Many parts of the country are reporting high or very high flu rates. The high case counts right now are striking, given that this is the time of year when flu typically starts to slow down. It is not entirely clear why the current flu season has been so severe. Doctors said vaccination rates have not been as high as they would like to see. Roughly 46% of children and a similar share of adults have received a flu vaccination so far this season. Flu shots reduce the chance of infection and might also help limit the spread of the virus to others. Some share of the cases could be a lingering consequence of pandemic lockdowns, when transmission of many common viruses slowed down as people practice social distancing. Flu season typically ends in May, which means it is not too late for a flu shot. It takes a couple of weeks for antibodies to kick in. Vaccination can reduce the risk of being hospitalized for the flu, and it can make symptoms less severe. Washing your hands frequently or wearing a mask in crowded, poorly ventilated areas can also reduce your risk. The flu spreads through tiny droplets filled with the virus that spray into the air when an infected person talks, sneezes, coughs, or even laughs. Droplets can cling to surfaces like doorknobs and countertops, where they can infect people who touch them and then touch their nose, eyes, or mouth. After you are exposed to the flu, it takes 1 to 4 days to start feeling sick. Sometimes people are contagious starting on the day before they develop symptoms, which can include fever, chills, and coughing. People with the flu are contagious for around a week. The symptoms of flu may sound similar to those caused by another viral infection, which is COVID-19. New combination at-home tests can help determine which virus You have, and while COVID remains a threat, the United States is experiencing its mildest winter wave of the virus, yet preliminary data from the last week of January in fact shows that a slightly greater percentage of people may have died from the flu than from COVID. The dominant virus infection that we are seeing this year is the flu. 1G United States Western States fossil fuel is not a clean energy source. Trump administration. Trump names oil and gas advocate to lead agency that manages federal lands. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization. The Guardian, February 12, 2025. Trump has nominated a longtime oil and gas industry representative to oversee an agency that manages 250 million acres of public land concentrated in western states. The president of the Colorado-based oil industry trade group Western Energy Alliance was named Bureau of Land Management Director, a position with wide influence over lands used for energy production, grazing, recreation, and other purposes. 2 Louisiana vaccines. The Louisiana Health Department says it will stop promoting mass vaccination. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization. February 14, 2025. The top health official in Louisiana said in an internal memo to the Louisiana Health Department on Thursday that it would no longer use media campaigns or health fairs to promote vaccination against preventable illnesses. Vaccines should be treated with nuance, recognizing differences between seasonal vaccines and childhood immunizations. The health department in New Orleans quickly said that it would not follow the lead of the state. We will continue to strongly promote childhood and seasonal vaccination and expand our efforts locally to fill any gaps left by the new direction of the state, said the director of the New Orleans Health Department said in an email. The Louisiana Health Department would also stop promoting vaccinations through partnerships and parish health units and wrote that state health officials should not instruct individuals to receive any and all vaccines, but instead should provide data about the reduced health risks associated with receiving vaccinations for many illnesses. Vaccines are one tool in the toolbox of ways to combat severe illness, and state health officials should focus on meeting people where they are during the COVID pandemic. Louisiana had among the U.S. lowest vaccination rates, and healthcare workers their struggle to combat misinformation about the safety of coronavirus immunizations. On Thursday, the Louisiana Health Department head also criticized how state and federal health authorities had responded to the pandemic and wrote that the implementation of vaccine mandates had been an offense against personal autonomy that will take years to overcome. Louisiana has had a Republican governor since 2024, and the Republican governor Landry appointed the current head of the Louisiana Health Department, John Bel Edwards. The Democratic governor who led Louisiana through the pandemic fought state lawmakers and Dr. Abraham, now the Louisiana Health Department head, then the Louisiana Attorney General, to implement vaccinate mandates. Dr. Abraham did not mention COVID in his memo on vaccination. Louisiana is experiencing a surge in flu this winter. 3 Texas measles vaccine. Measles outbreak hits town in Texas as of Tuesday. 22 children and 2 adults had been infected, all of whom were unvaccinated, local officials said. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization. February 12, 2025. A worsening measles outbreak has taken root in Texas, sickening 2 dozen and hospitalizing 9 on the western edge of the state, where childhood vaccination rates have dwindled in recent years. The outbreak comes as Robert F. Kennedy Jr., a staunch critic of childhood vaccines, has been nominated to be the U.S. Health Secretary, causing public health experts to worry that similar upticks of preventable illnesses will become more frequent. The Texas outbreak has so far been limited to residents of Gaines County, which borders New Mexico, and has roughly 20,000 residents. Last year, 82% of kindergarten students received the measles, mumps, and rubella vaccine, according to state data. That figure is roughly 10 percentage points lower than the average vaccination rate in Texas public schools and far below the federal target of for measles vaccination of 95%. Vaccine rates have been declining nationwide since the start of the COVID-19 pandemic in 2020 and now sit below 93%. An estimated 280,000 kindergartners in the United States do not have documentation of an M vaccine, according to federal data. Texas public schools require children to have received certain vaccines, including the M shot, but parents can apply for an exemption for reasons of conscience, including religious beliefs. Last year, more than 13% of K-12 students in Gaines County received a vaccine exemption. The cases had been concentrated in an insular community in the county among people who attend church and private schools together. Many of the children are also homeschooled. Serious complications of measles, including pneumonia and brain swelling, are possible, especially for children younger than 5. Roughly 1 in 5 unvaccinated people who become infected with measles is hospitalized, according to the Centers for Disease Control and Prevention. Ms. Anton said that all 9 of the hospitalized patients were school-age children, and that many of them had spent time in the intensive care unit. It is a serious disease, she said. State health officials warned that cases would likely pop up in surrounding communities because of the highly contagious nature of this disease. For Europe, Trump-Ukraine policy affects Europe. The new Trump foreign policy team has brought a message to European allies on AI, Ukraine, and more. It has already left many angered. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization. The New York Times, February 13, 2025. Trump began imposing tariffs before he began even cursory diplomatic negotiations, hitting allies and adversaries alike and wiping out years of trade agreements. While Trump was signing executive orders, his vice president J.D. Vance arrived in Paris and told an assemblage of leaders Europe could either get on board or get out of the way. Then came Ukraine. On Wednesday, the Trump defense secretary told a meeting of allies in Brussels that Ukraine must give up its objective of recapturing all its lost territory in the war with Russia. Within hours, Trump was on the phone with the Russian President Vladimir V. Putin, promising negotiations, but having already conceded territory Russia occupies, and an assurance to the Russian leader that Ukraine would never be in NATO. Meanwhile, Treasury Secretary Scott Bessent is in Kiev to begin negotiating American rights to the untapped rare earth metals of Ukraine. President Volodymyr Zelensky of Ukraine and European leaders were sidelined as bystanders to the negotiations about the fate of the boundaries of Ukraine, and to some degree the future of Europe. On Thursday, European leaders began pushing back against the Trump message, but recognizing that to trigger Trump wrath could leave them in a deeper freeze, it is crucial That Ukraine is closely involved in all talks on its future. Mark Rutte, the NATO Secretary General, said ahead of a meeting of NATO defense ministers in Brussels, sounding like a man who could not believe he had to state the obvious. John Healey, British Defense Secretary, said, "There can be no negotiation about Ukraine without Ukraine, and the voice of Ukraine must be at the heart of any talk." Zelensky, after initially thanking Trump on social media for pursuing a peace deal, said on Thursday that he would not accept any agreement negotiated without him participating. "It is important that everything does not go according to the Putin plan," he said. "There can be no talk about Ukraine without Ukraine." He insisted it remains to be seen whether the Trump administration heeds the warning, ignores it, or tries to weave a middle path, giving Europe and Ukraine a sort of backbench role in the negotiations. But by Thursday, the comments of Hegseth had created such an uproar among European leaders that he seemed to backtrack on whether preemptive concessions would be made to Putin. Trump spoke to Volodymyr Zelensky on Wednesday after his call with Putin. The Ukrainian president said afterwards, "Donald Trump informed me of what Putin had told him. We believe that American strength is sufficient to pressure Russia and Putin into peace." On Thursday, the foreign minister of Ukraine, Andriy Sybiha, said NATO membership remained a strategic objective for Kyiv as the cheapest way for the alliance to guarantee its own security, though it has long been opposed by Russia. 5 Germany MERS flirtation with neo-Nazis makes minimal dent in his popularity, as shown in recent poll. The would-be chancellor of Germany tries to get back on cruise control dogged by protesters, but apparently safe from damage in the polls. Friedrich Merz is putting a failed immigration gambit flirtation with AfD neo-Nazis behind him. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 non-profit organization. The New York Times, February 11, 2025. Friedrich Merz said if you drive 2 kilometers per hour too fast, the speedometer starts beeping. Those beeps are the product of a European Union regulation. For Merz, they were a timely and tidy example of the government intrusions that he blames for stymieing the German economy and frustrating its citizens. Merz and his party, the conservative Christian Democrats, endured 2 nervous weeks after he took a political gamble and broke a decades-old taboo by voting with rivals on the far right in a failed bid to toughen migration laws. Outcry followed rival candidates sensed an opening, but polls taken since the hubbub indicate that Merz has emerged relatively unscathed, even if he is now seen as a more polarizing figure. The former businessman and longtime conservative stalwart seems once again to be cruising toward the chancellorship. Merz is refocusing his stump speech on EU regulation, federal red tape, work ethics, energy costs, and other ingredients of what business leaders call the components of a German competitive crisis. He is telling voters that an increasingly volatile world needs a stronger and steadier chancellor at the wheel than the German current leader Olaf Scholz of the center-left Social Democrats. Rhineland-Palatinate, one state in Germany, has an economy that shrank by nearly 5% in 2023 since Merz broke the taboo of working with the Alternative for Germany, or AfD, parts of which are classified by German intelligence as extremist. Outraged voters have taken to following him from campaign stop to campaign stop. Some accuse Merz of working with Nazis, others call him one. He is not suitable as a chancellor, said one of about 150 protesters who gathered in near freezing temperatures. He has made the biggest mistake by voting with the AfD. Now the man carried a sign that read 5 minutes until 1933, a reference to the dawn of the German Nazi era. According to the latest Politbarometer survey, 30% of Germans say they will vote for the party of Merz, 1 percentage point more than in the end of January. The AfD sits second, with the Social Democrats and Greens lagging behind. Merz, he defended his decision, but vowed to never form a government with the AfD. 6 United States, a liberal explains his point of view from a Facebook repost with the comment, "Ron Howard has summed up what many of us believe." Excerpts edited by RAWSEP for brevity and clarity. And relationship to residents against wood smoke emission particulates, a 501c3 non-profit organization. I am a liberal, but that does not mean what a lot of you apparently think it does. I am getting tired of being told what I believe and what I stand for. Spoiler alert, not every liberal is the same, though the majority of liberals I know think along roughly these same lines. 1. I believe a country should take care of its weakest members. A country cannot call itself civilized when its children disabled, sick, and elderly are neglected. Period. 2. I believe healthcare is a right, not a privilege. Somehow that is interpreted as I believe Obamacare is the end all be all. I have yet to hear an argument against it that makes let people die because they cannot afford healthcare a better alternative. I am not opposed to paying higher taxes in the name of making that happen. 3. I believe education should be affordable. It does not necessarily have to be free, though it works in other countries, so I am mystified as to why it cannot work in the US. 4. I do not believe your money should be taken from you and given to people who do not want to work. I have literally never encountered anyone who believes this, ever. I just have a massive moral problem with a society where a handful of people can possess the majority of the wealth, while there are people literally starving to death, freezing to death, or dying because they cannot afford to go to the doctor. Fair wages, lower housing costs, universal health care, affordable education, and the wealthy actually paying their share would go a long way toward alleviating this. Somehow believing that makes me a communist. 5. I do not throw around I am willing to pay higher taxes lightly. I am fine with paying my share as long as it is actually going to something besides lining corporate pockets or bombing other countries while Americans die without healthcare. 6. I believe companies should be required to pay their employees a decent livable wage. Minimum wage should be enough for someone to work 40 hours and live 7. I am not anti-Christian. I have no desire to stop Christians from being Christians, to close churches, to ban the Bible, to forbid prayer in school. By the way, prayer in school is not illegal. Compulsory prayer in school is and should be illegal. All I ask is that Christians recognize my right to live according to my beliefs. I am offended that you are trying to force me to live by the rules of your religion. Be a Christian, do your thing, just do not force it on me or mine. 10. I do not believe the government should regulate everything, but since greed is such a driving force in our country, we need regulations to prevent cut corners, environmental destruction, tainted food, water, unsafe materials, inconsumable goods, or medical equipment. It is not that I want the hands of government in everything, I just do not trust people trying to make money to ensure that their products' practices are actually safe. With those regulations in place, consumers have recourse if they are harmed, and companies are liable for medical bills. Environmental cleanup. The alternative to government regulation is letting companies bring their bottom line into the equation. 11. I believe our current administration is fascist, not because I dislike them or because I cannot get over an election, but because I have spent too many years reading and learning about the Third Reich to miss the similarities. Not because any administration I dislike must be Nazis, but because Things are actually mirroring authoritarian and fascist regimes of the past 14. I believe in so-called political correctness. I prefer to think it is social politeness if I call you Chuck. And you say you prefer to be called Charles I will call you Charles. It is the polite thing to do, not because everyone is a delicate snowflake, but because when we know better we do better, so why not do better? How does it hurt you to not hurt another person? 15. I believe in funding sustainable energy, including offering education to people currently working in coal or oil, so they can change jobs. There are too many sustainable options available for us to continue with coal and oil. Sorry billionaires, Ron Howard. RAWSEP interjection here. There are too many sustainable and clean options to indoor residential wood burning for us to continue to burn. With those options include wind and solar and batteries to store wind and solar energy.
One introduction. RAWSEP View. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only for home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree. But it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen, and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lung, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom. The Eco-Design Wood Stove and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RAWSEP View. Purple air. PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.